What can you do when the doctor who has been treating your chronic pain condition suddenly tells you that he or she is no longer going to prescribe your pain medications anymore? This is a terrifying reality for a lot of people, especially as the opioid crisis has evolved. Although the governing agencies who oversee the prescribing of controlled substances are encouraging their doctors to work with their patients, a lot of doctors are simply opting to stop prescribing altogether. A lot of them are doing this because of the increased scrutiny, but a lot of other docs are really recognizing the growing body of evidence that for a lot of patients, short-acting opioids are just not the best treatment for long-term pain. For some patients, this means being transitioned to the care of a pain management specialty. Of course, that means the planets have to align around your insurance company covering this type of specialty, a pain management doctor being in your vicinity, and then hoping that it won't be months before the waiting list is finished. Some patients who've been prescribed short-acting pain medications for years might be switched to long-acting opioids, such as methadone or buprenorphine products. And while these can be effective for some types of pain, they still come with the baggage that the short-acting pain meds come with. Physical dependence on the drug itself, the need to orchestrate your life around getting to the clinic, worrying about losing the medication or the prescriptions. Now, of course, we've got the added worry about going anywhere with the possible exposure to the COVID virus. Some people suffer the perceived or maybe real judgment that they are drug seeking, particularly if there's any kind of a glitch at the pharmacy or maybe a newer substitute pharmacist. Abrupt cessation of either methadone or Suboxone products will, of course, result in withdrawal. The Coleman Institute has attracted patients who want to find out what life can be like without pain medications. Depending on the amount of pain medicine and the length of time someone has been using it, as well as other medical conditions a person might have, we can usually perform an outpatient detox in 3 to 5 days. We use an assortment of comfort medications. We work closely with the support person to have one of the safest and most comfortable accelerated opioid detoxes available in the country. A cornerstone of our treatment is to put our patients on some form of long-acting Naltrexone. The Naltrexone will take the place of the opioids on the very receptors that the pain medication had occupied. And while Naltrexone does not provide pain relief, it actually eliminates the physical cravings for these very addictive medications. When the Naltrexone wears off, there's no withdrawal because Naltrexone does not create physical dependence or cause a body to build a tolerance to it. The vast majority of our patients are delighted to find that once the opiates are out of their system, their pain is actually minimal, or at the very least, easily managed with over-the-counter medication. If you'd like more information, we are happy to discuss the Coleman Method with you, so give us a call. And in the meantime, stay safe.